And I'm happy to be back with you for another Facebook chat. You know what I love to call it, IAmPatient. And I can't believe we're going to be coming up on our year anniversary here next month in March. And I can't believe it's February of 2021 already. Where has time gone? I think for those of you that know me or are getting to know me, you know that I'm passionate about people and their families that live with conditions. Today's guest is no exception. I have a beautiful young woman here named Asia Brewer, and Asia is living with POTS disease. And I just learned something important. I thought it was rare because you never hear about POTS disease, but Asia's going to tell us a thing or two. It's often just because it has no awareness and it doesn't get diagnosed. So what is POTS? Well, POTS is a form of dysautonomia, and that's basically a disorder of your autonomic nervous system. It's the part of the nervous system that we don't think about, like controls your heart rate, your blood pressure, your body temperature. So it is a neurological condition. And we're going to talk to Asia to learn more. So Asia, thanks for spending your time with us on this February day.
Thank you so much for having me, Brenda.
Yeah.
So POTS is a form of dysautonomia, just like you said. And it's a condition that affects your autonomic nervous system. So I'm going to demonstrate it really quick. That way, whenever I share, you guys can kind of follow. So I saw this demonstration on York Cardiology. It was on YouTube, and he did the easiest, most simple demonstration to explain POTS. So basically, you have your sympathetic nervous system and your parasympathetic nervous system. And your sympathetic nervous system is what most people know as your fight or flight. And then you have your parasympathetic, which people know as your rest and digest. So basically, whenever there is a trigger, so let's say you're at home and one of your kids jumps out and scares you, that will be a trigger to your sympathetic nervous system. So it'll cause a rise in your sympathetic nervous system, and then your parasympathetic nervous system intervenes and it brings it back to equilibrium. That way your body is able to function properly. So your autonomic nervous system basically stays in an equilibrium state at all times. With a POTS patient, posture triggers that, and your pivot point moves down here. So even just the slightest trigger will cause a really big rise in your sympathetic nervous system. So things as simple as standing. So whenever you are sitting and you stand up for a POTS patient, that is a really small trigger in a person without POTS, but with a person with POTS, it's a very big trigger. So whenever that happens, it causes a rise in your sympathetic nervous system, which the bigger the rise, the longer it takes to get back to equilibrium.
And what are the risks for you because of this, this sort of out of balance? Like, what are the health risks? What do you feel? What does that mean in your day-to-day life?
So it means that every time you go from sitting to standing, you're at risk for falling, because whenever you go from sitting to standing, your blood just basically rushes down to your feet. So you lose blood from your brain, which can cause you to faint or become unconscious. So it makes it really hard. And whenever you're changing your posture, moving, bending over, doing a lot of just like bending over to pick up something off the floor, that can cause a rise in your sympathetic nervous system, which will also aggravate your autonomic nervous system, causing you to feel dizzy, lightheaded, out of breath. My heart beats really fast whenever I go from sitting to standing, even from lying to sitting. If I'm lying down and I sit up on a bad day, I have to lay right back down because of that. Change just really triggers it. Yeah.
Well, hearing this makes me think I have POTS too. I'm going to put it on the list. So I know that, we briefly spoke, and I mistakenly said, and I'll go look it up on NORD, N-O-R-D, to make sure that I'm not misspeaking again. I should have done that before. I said it's a rare disease. And you said, don't be so quick. It's a misunderstood, not often diagnosed, very poor lack of awareness. Tell us about that. What's your platform about awareness for POTS?
So with POTS, people often say that it's rare because they've never heard of it. But it's not as rare as people think it is. The problem is that people don't know enough about it to spread awareness. And so like you have your physicians and medical personnel that just don't know about it. And so whenever they see somebody clinically and they present with these symptoms, they most of the time get misdiagnosed with anxiety or depression or things like that, because they just don't know enough about POTS to even make the diagnosis. And there is a research that an average POTS patient, it takes up to 5 years for an average POTS patient to get diagnosed with POTS. And the crazy thing is that it takes 5 minutes. It's a 5-minute test. They can do a tilt table test, or they can even do an office setting diagnosis with just a reading of your orthostatic vital signs.
Wow.
Yeah. So it's really frustrating because 5 years, up to 5 years, but it only takes like 5 minutes, and you can tell when a person has POTS.
And I think that's so sad, Asia, too, because, I talk to more patients than probably anybody on the planet. I touch I'll have to pull the numbers. I think Snow Company reached, over 85,000 patients last year, like firsthand experience, not when you extrapolate Facebook numbers and stuff watching the show. And the thing that just always breaks my heart on these misdiagnoses, this leads to other things: depression, anxiety, thinking that, just fear. So many mental health things, because nobody spends the time to say, yes, you are ill. This is what you have. Now let's get you help. Is that an accurate statement in your experience?
Yes, absolutely. Okay, so with my
did you feel mental health issues? So tell me about those.
Yes. So I actually, during the start of my, getting my diagnosis, I saw a cardiologist, and I could actually, waiting in the room, it was the second cardiologist that I had seen, and waiting in the room, I could hear them I could hear them right outside the door talking and saying that I thought something was wrong. This was their words. She thinks something's wrong with her. Nothing's wrong with her. Her lab work was fine. Her lab work's fine. I don't know what she wants. Like, what does she want from us, basically? So when he came into the room and said, it looks like you're already on antidepressant medication. So what we're going to do is just up the doses. So I walked out of that appointment basically like, okay, maybe I am crazy. Like, maybe nothing is wrong with me. Maybe the reason why my heart rate is so high is because I have anxiety, but it was just frustrating because I already was put on anxiety medication and I could see no change in my symptoms at all, which is why I proceeded to see, to get a second opinion, basically, to be told that, basically I'm crazy and there's nothing wrong with me.
Honey, I can relate to you. I had the same thing happen to me 27 years ago. It sucks. And it's really why I got into doing this. I just never wanted anybody else to feel that way. It's a terrible feeling. And then you had to go for your third opinion.
Yes. And then I went for my third opinion. Yeah. And so I was working 3 jobs, and one of the jobs, I was a patient care tech at a hospital. I was charting and had gotten a call from one of the patients needing something. So I had gotten up And in mid walk, I got stopped by a nurse, and she said, "Hey, Asia, are you feeling okay? Because you don't look good." And I was like, "Well, my heart rate is always really high, and sometimes it can cause my face to look flushed a little bit, but I'm fine. Like it's been happening." And so basically she was like, let me listen to your heart. So she listened and was like, "Your heart rate is way too fast. I can't even count it." So they sent me down to the urgent care downstairs. I got an EKG machine. My heart rate was 188 there. They wheeled me over to the chest pain center, so I didn't walk.
Yeah, that's good.
My heart rate was 10 beats faster over there. So it was 198 whenever I got to the chest pain center.
Yeah, and you're a young woman.
Yeah, like that's crazy. And so they ran a bunch of tests there. Everything came back normal as expected. And they wanted me to go see another cardiologist. With me working at the hospital, though, I was fortunate enough to know about these cardiologists and which ones were good and which ones weren't so good. So I ended up choosing which one I wanted to see. So I saw him. He did a bunch of tests and everything, and those came back normal. I had an event monitor for like 2 weeks, and he did see a spike in my heart rate. So he put me on a beta blocker. I was on the beta blocker for about 5 days, was working, and it hit me. It just hit me at once. It hit me all at once. And I felt like I was going to die. I was in a patient's room taking vitals, and I was like, I need to get out of here. So I called one of the aides, another aide on the same floor, to go in there and continue taking the vitals because I had to leave. I told the charge nurse I was going downstairs to see my cardiologist, went to see him, and I was crying, and I was like, I need help. Like, this is not okay. I don't feel good. So he ended up admitting me into the hospital on the telemetry floor. So I was finally on a heart monitor where everyone could see my heart rate. And I was laying in bed, got up to brush my teeth, and I looked to the left, and the whole room was filled with medical personnel, crash cart, everything. My heart rate got up to like 210, and I was just brushing my teeth. And so I sat down on the bed and just waited for the doctor to come in. So he finally came in there, and he said, this was the day, and he said, "You have postural orthostatic tachycardia syndrome." And I was like,
can you say it again? Sorry, I had a little cough. Give me what does POTS stand for?
So that's exactly what he said. He said, "You have POTS, POTS, which is postural orthostatic tachycardia syndrome." So I looked at him and I was like, "What is that?" And he said that basically with posture change, my orthostatic, my blood pressure, my heart rate, and all of that stuff I was basically intolerant to posture changes.
Well, thank heavens you finally got diagnosed. Tell our audience how you get POTS. Do we know?
Yes. So POTS is not genetic, which a lot of people think that it is.
Yep.
You cannot be born with POTS. So POTS is brought on, most of the time it is brought on by an illness, like a viral infection. It can also be brought on to trauma to the body. So if you were to get in a car accident, it could be brought on by that. It could also be brought on by pregnancy, which is how I think I got it. A lot of people with POTS have some kind of underlying condition. So they have, like, somebody with EDS may present with POTS also, but they present with POTS because of their body being in stress from EDS, if that makes sense.
Yeah, that's great. Thanks for telling us. And, I think for everybody out there, you remember you are your own best champion, advocate, ambassador. Like, you matter. And if you have any symptoms like this or any other chronic disease that you're living with, that you're not having a great relationship with your healthcare team, find another one. If you are not
Yes.
being listened to and validated, take it in your own hands or let somebody help you take it in their own hands, because I don't want anybody that I love or is my little world of friends to suffer. You don't have to suffer, okay? And I think you're a really good example, Asia, of empowerment. I love that. I love that. Before we have to wrap up today, you referenced you thought you might have gotten POTS when you were pregnant. And I know there's a wonderful little girl that is the joy of your life. Tell me a little bit about your daughter.
Okay, so Kenna was born on February 4th, 2014.
Well, happy birthday coming up here, right? Or it is, yeah.
So she was born, and she has been the most wonderful, most patient child I have ever met. I don't say that just because she's my daughter. Like, she has genuinely been an angel. So there has been a couple times where I've passed out, and she's actually has been the one to call 911. In 2016 or 2017 is when she started calling 911. She was 2. It was like February or January 2017. So she was about to be 3, but she was 2. And she called for the first time. And then 2019, she called again. We actually went up to the sheriff's department, and they awarded her with an accommodation award for calling 911, on her bravery for calling 911. And then also we met with dispatchers as well, and they just wanted, they thought it was important for them to or for her to be able to put a face to the name. So if she was, and she, they could say, "Hey, I'm Amber, do you remember me?" So she was able to meet all the dispatchers that could possibly answer the phone if she had to call again. But yeah, she has been
Special
amazing.
little girl.
Yeah, special. She's a mama hen to me. She gets off the bus and she asked me before I could even ask her, "How was your day, Mom?" And when she's been the one that's been at school all day. So she's been wonderful. She's very patient. If I need to sleep, and she knows how important and how much better I feel after I sleep. So anytime that I need to take a nap, she always makes sure that I'm on my game and I'm taking my naps when I need them. So she's really great.
That's good. Yeah, it's so crazy. I can't believe how many similarities our stories have. My daughter was little and the same thing, and she's my heart, my whole heart. And I will tell you, she's an adult now. So reassure your little one that mommy's has this, but you're safe, you're okay, and you're not going anywhere, because my daughter's now into her early 30s and has for the first time told me that, that some of the anxiety she suffered was because as a young, small child, when she saw me so ill, was worried mommy was going to go somewhere and maybe never come back. So reassure her that, Asia, that you're there to stay and you're strong, and you two cuties, stay well, keep fighting the fight. And thanks for bringing the issue of POTS today to IAmPatient and letting us know about this condition. We really appreciate it.
Thank you so much for having me, Brenda.
You're welcome. And Asia, you can help me remind everybody, you know what? Whether you like it or not, whether you believe it or not, there still is a global pandemic happening. There are people dying every day. And there's one simple thing that we can do to take care of people like me and Asia and all of you. It's really simple. Wear the mask. Support people like me. I appreciate it. And Asia, thank you again. Until I think, in a couple weeks, but I do have a surprise coming up. We're going to start the exercise series. So I just got to look at the calendar, but stay tuned to the Snow Company's Facebook page. Stay tuned for more IAmPatient, and get ready to have your exercise clothes on so that we can all get a little bit of movement in. So Love everybody. Thanks again, Asia. Until next time, this is Brenda. See you soon. Take care, everyone. Bye-bye. Wear your mask.
Yes.